Healthcare behind bars. Beyond the Weinstein case. The recent hospitalization of Harvey Weinstein from Rikers Island following an alarming blood test has thrust the issue of prison healthcare into the national spotlight. While Weinstein's legal team protests alleged substandard medical care, his case illuminates a far broader crisis affecting hundreds of thousands of incarcerated individuals across America's correctional facilities. The irony of Weinstein's situation lies not in the quality of care he claims to receive, but rather in the fact that his complaints have garnered significant media attention, a privilege rarely afforded to the vast majority of incarcerated individuals. As a former media mogul with substantial resources and legal representation, Weinstein's experience stands in stark contrast to the typical inmate's struggle for basic medical attention. Understanding the carceral healthcare landscape. The American jail system serves as the primary entry point into the criminal justice system, with local facilities like Rikers Island primarily functioning as pre-trial detention centers. These institutions house a population that is predominantly unconvicted, with approximately 3/5 of detainees awaiting trial, often simply because they cannot afford bail. The overwhelming majority face non-violent charges, yet find themselves caught in a system ill-equipped to address their medical needs. The demographics of incarceration tell a compelling story of systemic inequality. Most detainees come from communities that have faced historical neglect and economic marginalization, with median pre-arrest incomes hovering around $15,000. This economic disparity reflects a broader pattern of governmental priorities, where funding for social services has consistently declined while police and jail budgets have expanded. For many communities, jail has become the default public institution, a disturbing reality that speaks to the breakdown of social support systems. The medical crisis within prison walls. The healthcare challenges in correctional facilities extend far beyond isolated incidents. Incarcerated individuals display disproportionately high rates of mental illness, substance use disorders, and chronic medical conditions. Many arrive with complex health needs that have gone unaddressed due to lack of access to regular medical care in their communities. The jail environment, with its inherent stressors and limitations, often exacerbates these pre-existing conditions. Statistics paint a grim picture of medical care in detention facilities. The first week of incarceration proves particularly dangerous, accounting for 41% of all jail deaths. This startling figure underscores the critical nature of initial medical screening and intervention, processes that are often rushed or inadequate due to overcrowding and understaffing. The structural barriers to adequate care. The fundamental challenge in providing adequate health care within correctional facilities stems from their primary design as security institutions rather than medical facilities. Medical care often takes a backseat to security protocols, creating delays and barriers to treatment. Healthcare providers working within these institutions face the constant challenge of balancing their professional obligations to patients with institutional security requirements. The privatization of correctional healthcare has introduced additional complications. As profit-driven contractors assume responsibility for medical services in many facilities, concerns about cost-cutting and quality of care have intensified. Some facilities have implemented co-payment requirements for medical visits, creating an additional barrier for indigent inmates seeking care. The absence of mandatory national standards for correctional health care has resulted in a patchwork system where quality of care varies dramatically between facilities. The impact of overcrowding and understaffing. Chronic overcrowding and understaffing in correctional facilities create a perfect storm that compromises healthcare delivery. Medical staff often find themselves overwhelmed by the volume of patients, leading to delays in care and rushed consultations. The high-stress environment contributes to staff burnout and turnover, further destabilizing the continuity of care. Security staff, who often serve as the first point of contact for medical complaints, frequently lack the training to properly evaluate medical emergencies. This can result in delayed responses to serious conditions and unnecessary suffering for inmates. The prevalence of mental health issues among the incarcerated population adds another layer of complexity to an already strained system. The cost of inadequate care. The consequences of substandard correctional health care extend far beyond the prison walls. Most individuals in jail will eventually return to their communities, often with their health conditions worsened by their incarceration experience. This creates a revolving door between jails, emergency departments, and the streets, generating significant costs for the healthcare system and society at large. The lack of comprehensive data on deaths in custody represents a shocking oversight in our understanding of the problem's scope. Despite the constitutional right to healthcare for incarcerated individuals, a right unique to this population, there remains no standardized system for tracking and reporting adverse outcomes in correctional facilities. Towards solutions and reform. Addressing the crisis in correctional healthcare requires a multifaceted approach. First and foremost, reducing jail populations through bail reform and diversion programs for nonviolent offenders would ease the burden on existing medical resources. This requires a fundamental shift in how we approach public safety and justice, moving away from punitive measures toward more constructive interventions. External oversight and transparency mechanisms are essential for maintaining standards of care. Public partnerships rather than private contractors may offer a more sustainable model for providing healthcare services, particularly when integrated with community health systems to ensure continuity of care upon release. The role of security staff in healthcare delivery needs careful examination and reform. Guards should not be making medical decisions, and access to care should not be contingent on security protocols except in clear cases of risk. The practice of requiring co-payments for medical visits should be eliminated, as it creates an unnecessary barrier to care for an already vulnerable population. Looking forward. The attention generated by Weinstein's case provides an opportunity to examine and address the systemic issues in correctional healthcare. While individual facilities like Rikers Island may face particular scrutiny, the problems are endemic to the American carceral system as a whole. True reform requires acknowledging that jails and prisons are not equipped to serve as primary healthcare providers for society's most vulnerable members. The increasing expenditure on punishment while basic community health needs go unmet represents a fundamental misalignment of priorities that must be addressed. As we move forward, the focus should be on creating systems that truly promote public safety and health, rather than perpetuating cycles of incarceration and poor health outcomes. This requires not only reforming correctional health care, but also strengthening the community health resources that can prevent involvement with the criminal justice system in the first place. Only through such comprehensive change can we begin to address the healthcare crisis behind bars and its impact on society as a whole.